All right. Hi, North Park. This is Amy Ward, your superintendent for North Park Schools, and I am joined today with our school nurse and public health nurse. So the reason why we're doing this video is just because there's a little bit of community transmission of COVID-19 right now, and in the school system, and there's a lot of questions out there, and we thought we would just try to clear up some of those questions that have been developing in the last couple of weeks. So, first of all, um, some people might not know who you are, Marcy. Can you just kind of tell us a little bit about yourself and your role with our school and community?
Sure. My name is Marcy Clendenin. Many parents or other community members may know me as Marcy Hines. I was born and raised here. I'm a 2002 graduate of North Park High School. And in November, I was brought on to take on the role of public health nurse. And also, with that, is being the school health nurse or the school nurse. I have been a nurse for 13 years. And I have not been in a school nurse role or in a public health role. I've been mostly in hospital and long-term care settings in my jobs, but I've done a lot of like case management stuff and making sure people have resources that they need to be healthier. And so that was one of the things that I feel like I bring to North Park and Jackson County is those abilities as a nurse. I ever since the beginning, I told people, I said, I don't know how to be a school nurse and I don't know how to be a public health nurse, but I am a nurse and I feel like I'm pretty good at that. And so that's a strength that I feel like I build upon. I am currently working on my bachelor's degree and I'll be done in a few months. So I'm excited about that. Not sure why I decided to start in the middle of a pandemic, but I moved in the middle of a pandemic. So I guess why not start school too? But I'm just excited for the changes. Obviously, this role has brought some challenges. It's also brought some really cool moments that are this is why I was called home. And I'm really excited about those and to be able to build on those. And I'm always willing to face a challenge. So let's do this.
Well, I am very grateful for you because you've really helped us in navigating the challenges that we face right now. And we are facing a lot of challenges and around COVID. And I know that everybody is probably sick of hearing about COVID. However, it is really important to know how it's affecting us here in Jackson County and at our school.
One of the big things that I just want people to know is yes, we do have some COVID. We have been so lucky to not have any deaths related to COVID. I think sometimes we end up in a little bit of an isolation bubble of things don't happen to us here. COVID is happening to us. It's happening to our community members, and our community members are getting hospitalized. Not all, not even a majority. I believe our total hospitalization count since the beginning of the pandemic is 9, which is great. But a concern of mine is, hospitals fill up on the Front Range. They fill up in Steamboat, Craig, anywhere we could potentially send someone who is drastically ill from COVID, or even if we have a trauma such as a car accident or a fire or something traumatic like that in our community. One of the biggest concerns that I don't know that we're attuned to because we don't have a hospital in our county is just the ability to get care, and that's part of why I was brought here was to help increase access to healthcare. And so I just want to make sure that people realize that this is real, this is happening, and how it affects us is if you need medical care outside of Jackson County, that might be tricky, and that's scary to me. That is really scary, being 60 miles from the nearest hospital and then being full or short staffed because of all this is that's scary. One of the other things is we know that Jackson County, the work pool is fairly limited. So, we're working on skeleton crews or, just the best we can in our gas stations, in our grocery stores, just all over. And, if one person in a business gets sick, that affects the whole business. And we just, we're just really trying to keep businesses open, the schools open, and keep people healthy and safe. And that's really our main goal. And so, like I said, those are the ways that COVID affects us. It affects our economy when we have to close businesses because of quarantines, and it affects our ability to get health care. And those are things that can be really scary for us in Jackson County, because those are things that, are very important to everyone, day-to-day life, basic human needs. So those are the big ways that I feel COVID is affecting us in Jackson County that not everyone may notice or realize. So just to be aware of those things.
Yeah, we are definitely seeing the impact of that at the school with lack of substitute teachers, and when our staff is quarantined or they get ill, it's becoming increasingly difficult um, to have substitutes that can fill those roles even in a custodial manner. And we are definitely feeling that a little bit this week. So it's important for us all to stay healthy and safe and take the precautions so that we can keep our businesses and school open. That is number one for me. Is I want to be able to maintain in-person learning and keep our staff safe and keep our students safe. And we're going to continue following guidelines to make sure that everybody does stay healthy and safe. So, in kind of thinking about that, what can we do to prevent COVID illness as well as the spread of COVID through our community and school?
Sure. One of the most important things that we can do is stay home if we're sick. Um, Keeping our children home if they're sick. I mean, I get it. I have an 8-year-old myself, and if she gets sick, we have grandma and grandpa here, but I'm so scared to spread that to grandma and grandpa. So I would need to stay home, and that's a crunch when I'm really needed in the community. And I understand that, and I empathize with that because I'm there. But at the same time, I would never want another family to have to go through some sickness or illness because I was being irresponsible or because I just felt like I was too busy. I think it's just really important to keep an eye on our kids. And that's nothing. It is hard as a parent some mornings to get your kiddo out the door and pay attention to how they're feeling. You're just trying to go into where you're going, and I get it. I think about some mornings, I'm like, oh gosh, I didn't really take that 10 seconds to say, how are you feeling this morning? And even me, like I said, as a nurse, as a mom, it's hard, and I get it. So like I said, keeping our kids home um, when they're sick, and even us staying home when we're sick. I know it's also hard for us as adults because we feel like we have so much to do and so much on our plate that we just don't have time to stay home and be sick. But it's really important to help prevent that spread. Um, and then get tested. If you are sick, get tested. It's so important to know where you stand, whether you have COVID. Not all sniffles and colds are COVID, and that's okay. But it's better to know and not spread it everywhere than it is to not get tested. So we want people to get tested. We do have vaccines available here at Public Health. We have several, and I think we'll talk about that here a little bit later. But getting vaccinated is also great. Our vaccines, they're safe and they're effective. Like I said, we'll talk about those later. And also, if masking works, it absolutely works. It keeps those particles from leaving your mouth or from getting out. Um, and so if you're more comfortable masking, I know, Amy, you guys at the school have been so great about supporting staff or parents or students who just feel more comfortable masking. I think it's great to have that culture of this is your choice. And, I think we've worked really hard to do that. Whether you choose to get vaccinated, whether you choose to mask, we support that decision, but we also need to realize sometimes there's consequences to our decision. And also, you know, but we want to support that, but also be mindful that sometimes it doesn't work out in our favor when we do that.
So, let's say I do start feeling sick, or someone in my family is feeling ill. What should I do?
So first of all, so there's a couple of things that we can do. Is first of all, if you are feeling sick, contact either the clinic or public health. So the clinic and myself have worked very, very closely together on how sick is the person that's calling. Are you just kind of feeling crummy, you want to get tested to make sure and be responsible? And you know, I'm more than happy to swab people that are in that category. There's another category of people that they're sick and they feel like they need to be seen, by a provider. And so that's who usually the clinic is testing. Unless I happen to be out, then they're happy to test those guys as well. But like I said, there's those two categories. So for me, it's more the healthier. I just feel kind of crummy. I'm just checking to see how I am, or I don't need to be seen. I just need tested. That's who I'm seeing, and I'm more than happy to do that. I'm here Monday through Friday. I am at the school on Thursdays, so I don't usually test people on Thursdays just because I am at the school. But again, the clinic is more than happy to take up that slack for me when I am at the school, so they can do that. And then if you're sick, and be seen. And we do know that there are things other than COVID going around. We have seen a few cases of influenza. We've even seen some cases of strep. And so our clinic is really good about not always jumping to COVID first, but doing some true diagnostics and find out what's going on and where does this fit. I'm not saying they won't test you for COVID. I'm just saying that, there a lot of places that I've heard through other people are, well, you have to have a negative COVID test before we'll see you for anything else. And that doesn't make sense to me. We really need to be looking at all the aspects. But again, influenza is contagious, so is strep throat. So these are things that we want to find out and know so that we can keep people home and safe from being sick, whether it's COVID or strep or influenza. So, like I said, give the clinic a call, give myself a call, and I think we'll put the phone number down in the resources when we send this out. And if you're not sure, call me. Let's talk about it, and I'll kind of triage and find out where you need to go.
Well, that sounds great. And again, stay home. Um,
Exactly.
yeah, so or you start feeling a little better,
Yeah.
and it's just good for you. Um,
Yes.
so, what happens if a staff member or a student tests positive for COVID?
Sure. So we've definitely seen some changes. So last school year, I'm sure a lot of people remember, we did have to quarantine, for instance, the elementary, the senior class. There were a lot of quarantine, not a lot, I shouldn't say a lot. I think we did very well, but there were some quarantines that we did have to do based on those guidelines. Those guidelines have changed. They even changed from the time we started school to September 10th, I think it was. Um, and so some of those changes are doing what we call a targeted quarantine. We are just going to look at who was around these students very, very closely. Is it considered a close contact? Also, if they're in a classroom setting, because some of the data last year showed that most of our kiddos that we saw that got COVID in a community setting, or like summer camps and stuff like that, those close contact type areas. We didn't see a lot of classroom exposures that a whole bunch of class kids got exposed. Was it from masking? Could have been. That was definitely helpful. But because of that, we don't have to consider classroom exposures quarantinable or close contacts, I should say. So if a student has it and just went to school, went about their normal day, the other kids in their class or even in the hallways wouldn't necessarily be considered exposed. So we just want to let you know, and many of you have already seen the letter that we've sent out, that, hey, your kid might have been exposed. Keep an eye out on your kiddo. And that's when we really need to step up that 10-second in the morning. How are you feeling? And make sure we know that our kids know that they can tell us that they're not feeling well and that that's okay. So that's one of the big changes. However, that doesn't mean we're not going to quarantine people. Such as this recent one, we found that there were some closer exposures that we felt were higher risk, and therefore, following the guidelines, we did have to quarantine most of a class. So that's where we look at it. We are completely following the guidelines, and we do our best to do that. And every situation is different, and every situation gets evaluated, and we really truly dig as deep as we can So just know that this is not a, well, we're just going to do this, or a, nope, we're going to quarantine everybody, or a, oh, well, their last name is this, I'm not going to quarantine them. It has nothing to do with that. It purely has to do with the guidelines and the definitions that we have to go by. And they are long. The school guidelines is probably over 40 pages, and then just the community guidelines are quite long as well. So we really have to look at each situation uniquely and what fits. So that guideline. And there's not one that says for every exposure either. And so sometimes we have to be a little creative and find out which one fits this scenario best. And sometimes that's difficult. But know that we're doing the best that we can, and we have the student and the staff safety at heart at all times. And that is really just what we're looking out for and trying to do the best we can to keep school open and as many kids in school as we can.
Yeah, that's definitely the goal, and I appreciate public health, the public health team. It's not just you, um, and we talk over every situation, and always go back. Even sometimes our emotions kind of get into it, and then we have to always remember, let's go back to the guidelines. Be
Mhm.
consistent with the guidelines, and
Yep.
always follow the guidelines. And then we as a school system, we're required to send out notification every new case. So it seems like cases have been popping on Sundays. So we've been sending those out on Sundays. And then if we get another notification on Monday, guess what? We are going to problem solve that, and we're going to send out another uh, notification out, even if it's the very next day in a very similar situation, because we are required to do that. Um,
Absolutely.
and so let's say a student or a family is considering getting a vaccination. Where can they get one, and if they have any questions, where should they go with those questions?
Sure. Well, first of all, give me a call. If anybody has any questions, I am happy to talk about any fears, and then we can talk about the data and the facts. That's very much how my brain works. And so, what I've been telling people is it is a very personal choice to get vaccinated. And I completely understand that. For me personally, it was a no brainer. I'm swabbing COVID people, I'm around these people. For me, it was a no brainer, but for others it's not an easy decision. And so I just want to talk through those fears and talk about the real data. And I tell people, if you talk to me and I give you my data and you talk about it with your family and you think about it and you're like, it's just, we just don't feel like it's right for us, okay, great. I just ask that you have made that informed decision.
All right, thanks, Marcy. So, what if I've been exposed? Where should I go, and how do I get tested?
So there are a couple options that we kind of already talked about, and that depends on your level of symptoms. Do you need to be seen by a provider, or are you okay with just coming to me? So one of the thing is, if you have been exposed, we do ask that you wait 3 to 5 days, or about 5 days, to be tested. So, and a lot of people want that rapid test. We unfortunately right now can't offer that rapid test, and it does take 3 to 5 days to get results for us. So, SEMO and Laramie do offer by rapid tests.
So I know that the state has pushed out a link that I'm going to be sending out to parents, where you can get free tests sent to your home and just have some on hand. So I'm going to put that link into the resources when this is sent out. Feel free um, to use that link and get some rapid tests at home. Or is there any caution to that we should be concerned about?
The only thing is those tests work best when people are symptomatic. So you would want to test if you had symptoms. They're not always very accurate in that. Well, I've been exposed but I feel okay. They're not always that accurate in that aspect.
Mm.
Um, The other thing is, if you do get, excuse me, a positive test, let public health know. Because we would want to confirm with the test that we do and send it out to the state lab.
One thing I think, if families do opt for that free home test, and I think you can get some at some pharmacy, over the counter at some pharmacies
Absolutely.
as well. That may be an option for your family to, if someone is sick at home, to help you make those decisions about, you know, not sending your child to school until you know for sure, if it is a COVID or not. And I mean, I feel like COVID transmission is circling throughout our community, and not all of those are confirmed tests. Families, aren't feeling well, um, and they're making those decisions anyway. And it would be great just to make having some of those decisions be based on the data, but knowing that those are not completely accurate.
Yeah. But they for sure give you that idea of where do I stand, you know.
Yes, absolutely. So, is there anything that you want individuals to know about the process of COVID case investigations? Like, once someone does have a positive case, what does that investigation entail?
So the biggest thing I just want people to know is nobody wants to be the positive case in town. Nobody wants to get that call from public health. So I just kind of am asking for a little grace. Sometimes those conversations are difficult. Families are put in situations that are difficult for them, and I understand that, and I definitely empathize with that. Um, but I just want people to really know that we're not looking to close schools. We're not looking to close businesses. We're just looking to keep people safe. Um, and that we understand the frustrations. And, I'm not going to sit here and say that everybody quarantines the way that they're supposed to. I know that. And it also makes it difficult when some of us are doing the right thing and others aren't. Um, but just know that public health is working diligently to keep our county safe and healthy and to keep our schools and our businesses open, because that's the number one priority for us.
Absolutely. And I know throughout the last couple of weeks, when, we have been sending out some communication around just, a couple of positive COVID cases, um, that we also get individuals that call us and say, "Hey, do you know about so and so?" Or I know that so and so got tested, somewhere else, and they are at homecoming or whatever, um, or they might have been with, someone else. We can only really act on what we know for sure. And when there are, rumors out there, because, we're a small town, we can act on anything
No.
that is rumor. We can only really act on what we know for sure.
Yeah. And, I have gotten several phone calls of concerned people saying, well, I heard they tested positive, but they're out and about. One of the other things that I just want to mention is, you know, there's a lot of pieces to that puzzle that people might not know about. One of those being when their symptoms started, when they tested, when, they might have been sick for a while and stayed home and then got tested and only have 2 days of a quarantine left. So, of course, you saw them. You know, um, I think it's good to be diligent, and I appreciate that about our community. But at the same time, just be understanding that there is probably a lot of information that we're not going to share, nor can we legally, about those cases. But just know, and like I said, offering people grace. I want to believe that most people are going to do the right thing. Um, I know that there are some that don't, but most do the right thing. And um, I think a lot of times there's not always a reason for concern, but just know that there is a lot of pieces to that puzzle. Or you just heard the rumor and that could have been from a month ago that they tested positive, just keep those kinds of things in mind. But again, we can't act on rumor. We can't act on, well, I heard so and so was sick, unless we have a true positive test that shows up in our Colorado system that we have. There's not there's not a lot I can do, and I don't think it's really fair, because if I was rumored to be sick and somebody came up to me and was like, "Oh, well, you had the COVID, right?" What? Like, and me as a healthcare professional, that's not okay. So we're not going to be chasing rumors. We're going to stick with what we have. And there is sometimes a delay. A lot of states are very backed up with COVID because COVID is happening more again. And it takes longer for us to get that information, which is unfortunate. And it does cause some issues for us sometimes. But we have to do the best that we can with that, because there's not much we can do about other states and how quickly they get us the information.
And just also just to kind of follow up on that, whenever individuals are quarantined, um, we talk through those, but most of that is a result of public health doing their investigation, and then public health determining who needs to be quarantined, for how long that quarantine is, and then that information is passed on directly to the person or the family who is quarantined, and we try to protect that information completely. We don't share with our teachers who was tested positive. I mean, sometimes in a small school and in a small community, of course, that information, um, you know, it seeps out from here and there, but that is not information that we share
No.
out.
And the same with public health. We do not, even when we call to say you've been in close contact, most of the time when I call and say you've been named a close contact, they already knew that the person was positive, but because that person texted them first. And that's okay. There is nothing wrong with that. So then we just talk about how long they need to quarantine and what that looks like. And so sometimes it's really great. Sometimes people avoid me like the plague. But it, or should we change that to avoid you like COVID? I'm not sure.
Yeah.
um, but yeah, like I said, nobody likes those conversations. But just know that we absolutely take all the steps that we can in our realm. Not only is it a HIPAA compliance for me as a healthcare provider, but also a FERPA for the school, that we can't disclose that information. So if people are hearing who has it where, it's not from us.
Well, we thank you guys for being such a great team to work with at Public Health, and as our school nurse too. Thank you so much. And if you want to learn a little more, we hope that this has been helpful to answer some questions. And there are some links that you can learn a little bit more. There should be a link of, we've sent this out several times. How sick is too sick, when you're just, when you're wondering, should I keep my kids home or not? That's a great guide.
And I
There is,
really like that too, because it doesn't just talk about COVID symptoms. It talks about, nausea, vomiting, diarrhea. It talks about all those things and how long you should keep your kiddos home. And so I think it's a great tool that CDPHE has provided for us.
I totally agree. And another one of their resources is a quarantine flow chart, help you understand that a little bit more. I think, Mercy, you're including a link about vaccine website and to
Yep.
learn a little bit more
and
about
that is
vaccines.
and that is the CDPHE website on vaccination. And it's just, again, like we talked about earlier, that good, solid, evidence-based data and information to help you feel a little bit more comfortable with this vaccination. Again, if I do vaccinations every Wednesday from 10 to 4 here at the public health office, we don't require appointments at this point, so you can walk in. And we have both the Pfizer and the Moderna available, and Pfizer is approved for those 12 and older. So there's a lot of kiddos that we definitely could could get vaccinated to help keep things safe.
Yeah, and I think that's one thing. Like when I had my direct exposure, I was vaccinated, so I did not have to quarantine. I
Mm-hmm.
did wear a mask for 2 weeks just as an extra layer of protection. But if you're vaccinated or wearing masks, then you don't have to quarantine in the same way
Yep.
that you would. You're not. So
Yeah. And
it's
so when
a good
we'll
step.
just really fast touch on what happens if you're vaccinated and you are deemed a close contact. So what we do there is we let you know that yes, you have been exposed, and to keep an eye on yourself. If you're fully vaccinated, which is 2 weeks after your second shot, or 2 weeks after the one, if you are an adult and got the Johnson and Johnson, um, then we would talk about that, and you wouldn't really have to change your life that much. It is nice to wear a mask, and it kind of protects those around you in case you do get breakthrough cases. In no way is the vaccine 100% effective in preventing COVID. That has never been a conversation. What it is very effective of in the 90% is keeping people from getting severely ill and ending up on a ventilator, ending up hospitalized, ending up in the ICU. That is where this vaccine is very, very effective, and they are safe. I tell people I've had mine since January, and I have not grown a tail yet. So they are very safe. So just wanting to throw that out there that, yeah, quarantining guidelines are different if you're vaccinated. And so some people do that because they have been quarantined more than enough and they're tired of it. And it was worth it for them. So I get that. I understand that. And so, whatever your reason, it's supported and will get you taken care of.
Well, thank you for that. And thank you for the time to kind of do a little interview with me. I appreciate it. And North Park, if you have any questions, feel free to reach out to the clinic or public health team or Marcy as a public health nurse and get your questions answered. Thank you so much, Marcy.
Thank you. It was great meeting with you guys today.